An ICP reviews a study that found no significant difference in CLABSI rates between two chlorhexidine concentrations P equals 0.30. The sample size was small n equals 60. What type of error might this represent? A. Type I error, alpha error, falsely concluding there is an effect when there isn't. B. Type Roman 2 error, beta error, failing to detect a true difference due to insufficient power. C. Confounding a third variable is causing the null result. D. Ecological fallacy, drawing individual-level conclusions from group-level data. The correct answer is type Roman 2 error, beta error, failing to detect a true difference due to insufficient power. A type Roman 2 error, false negative, occurs when a study fails to detect a true effect, often due to small sample size, insufficient statistical power. A study that finds no significant difference with a small n may simply lack the power to detect a clinically meaningful difference. Power analysis prior to the study determines required sample size. What is the purpose of an airborne infection isolation room IR? A. To prevent healthcare workers from being exposed to droplet-transmitted pathogens. B. To maintain negative air pressure relative to the corridor, preventing airborne particles from escaping the room. C. To provide positive pressure rooms for immunocompromised patients. D. To reduce environmental contamination from bloodborne pathogens. The correct answer is to maintain negative air pressure relative to the corridor, preventing airborne particles from escaping the room. An air maintains negative pressure minimum -2.5 Pa relative to adjacent areas, provides 12 air changes per hour or 6 for existing facilities, and exhausts air to the outside or through HEPA filtration. This prevents contaminated air from flowing out when the door is opened. Scabies is caused by which type of organism? A. A virus. B. A bacterium. C. A mite, Sarcops scabii. D. A fungus. The correct answer is a mite, Sarcops scabii. Scabies is caused by the mite Sarcops scabii, which burrows into the skin. It is transmitted by direct skin-to-skin contact, and crusted Norwegian scabies is highly contagious, requiring contact precautions. A hospital is conducting a mandatory education program for all employees on the facility's new infection control policies. Which of the following is the most effective way to evaluate the effectiveness of the program? A. A pre-test and post-test to assess knowledge. B. A survey to assess employee satisfaction with the training. C. Direct observation of employee practices. D. All of the above. The correct answer is all of the above. A comprehensive evaluation of the effectiveness of an education program should include a variety of methods, including knowledge assessments, satisfaction surveys, and direct observation of practice. An infection control professional is developing a new policy on hand hygiene. Which of the following is the most important factor to consider? A. The availability of alcohol-based hand sanitizer. B. The location of sinks. C. The compliance of healthcare workers with the policy. D. All of the above. The correct answer is all of the above. When developing a new hand hygiene policy, it is important to consider all of the above factors: the availability of supplies, the location of sinks, and the compliance of healthcare workers. A successful hand hygiene program requires a multifaceted approach. Clostridioides difficile causes disease primarily through which mechanism? A. Direct invasion of the bloodstream. B. Production of toxins, toxin A and toxin B, that damage colonic mucosa. C. Release of endotoxin from its cell wall. D. Formation of biofilm on heart valves. The correct answer is production of toxins, toxin A and toxin B, that damage colonic mucosa. C. Difficile pathogenicity is driven by toxins A and B, which disrupt the colonic epithelial cytoskeleton, causing inflammation, fluid secretion, and pseudomembranous colitis. Its spore-forming ability also explains environmental persistence and the need for soap and water hand hygiene and sporicidal cleaning. Prions, the agents of transmissible spongiform encephalopathies, are unique among pathogens because they: A. Contain DNA only. B. Contain RNA only. C. Are infectious misfolded proteins lacking nucleic acid. D. are large bacteria. The correct answer is, are infectious misfolded proteins lacking nucleic acid. Prions are infectious, misfolded proteins PRPSE that contain no nucleic acid. They induce normal cellular proteins to misfold, are extremely resistant to standard sterilization, and cause diseases such as Creutzfeldt-Jakob disease. Biofilm formation on indwelling devices contributes to infection chiefly because biofilms a. increase antibiotic penetration, b. protect organisms from antibiotics and host defenses, c. are easily removed by flushing, d. only form on sterile surfaces. The correct answer is, protect organisms from antibiotics and host defenses. Biofilms are structured communities of organisms in a protective extracellular matrix on device surfaces, catheters, prosthetics. They shield bacteria from antibiotics and immune clearance, making device-associated infections difficult to treat without removing the device. In emergency preparedness, the IP's role in incident command typically includes a. directing all hospital operations, b. advising on infection control measures, PPE, isolation, and surge capacity for infectious threats, c. managing the cafeteria, d. handling payroll. The correct answer is, advising on infection control measures, PPE, isolation, and surge capacity for infectious threats. During an infectious disease emergency, the IP serves as a subject matter expert within Incident Command, advising on isolation, PPE, screening, cohorting, and surge infection control needs to protect patients and staff. Which of the following is the most important component of a successful hand hygiene program? A. The availability of alcohol-based hand sanitizer. B. The location of sinks. C. The education of healthcare workers. D. The monitoring of hand hygiene compliance. The correct answer is, the monitoring of hand hygiene compliance. While all of the above are important components of a successful hand hygiene program, the monitoring of hand hygiene compliance is the most important. This is because it provides feedback to healthcare workers and allows for the identification of areas for improvement. Which of the following is an example of an engineering control used to prevent the spread of infection? A. Hand hygiene. B. Personal protective equipment PPE. C. A negative pressure isolation room. D. A sharps container. The correct answer is, a negative pressure isolation room. Engineering controls are physical changes to the work environment that isolate or remove a hazard. A negative pressure isolation room is an example of an engineering control that is used to prevent the spread of airborne pathogens. Which of the following is a fomite? A. A mosquito carrying malaria. B. A contaminated bed rail or stethoscope. C. An infected patient. D. Airborne droplet nuclei. The correct answer is, a contaminated bed rail or stethoscope. A fomite is an inanimate object or surface, for example bed rails, stethoscopes, doorknobs that can become contaminated and transmit pathogens via indirect contact. A mosquito is a living vector, not a fomite. A facility experiences several healthcare worker TB conversions on one unit over a short period. The most appropriate response is to A. Ignore as coincidence. B. Conduct a contact exposure investigation and review the TB infection control program, for example ventilation, IR use, respirator practices. C. Test all patients for HIV. D. Close the hospital. The correct answer is, conduct a contact exposure investigation and review the TB infection control program, for example ventilation, IR use, respirator practices. A cluster of conversions suggests possible nosocomial transmission. The response includes an exposure investigation, identifying a possible source patient, and reviewing engineering controls, ventilation, IR, administrative controls, and respiratory protection practices. Which precaution category requires placing the patient in a single room and wearing gloves and gown upon room entry? A. Airborne precautions. B. Droplet precautions. C. Contact precautions. D. Standard precautions. The correct answer is contact precautions. Contact precautions require single room or cohorting, gloves upon entering the room, gown if clothing will contact patient or environment, and hand hygiene before and after. They apply to organisms spread by direct skin-to-skin or indirect surface equipment contact. In outbreak investigation, an environmental or microbiologic sampling strategy should generally be a. Performed broadly and routinely on all surfaces. b. Hypothesis-driven and targeted based on epidemiologic findings. c. Avoided entirely. d. Done only after the outbreak ends. The correct answer is hypothesis-driven and targeted based on epidemiologic findings. Environmental sampling is most useful when guided by epidemiologic hypotheses, for example, a suspected source identified by the line list analysis. Indiscriminate culturing wastes resources and can produce misleading results. A healthcare worker has a documented history of a positive tuberculin skin test (TST). Which of the following is the most appropriate way to screen the healthcare worker for tuberculosis? A. A repeat TST. B. An interferon gamma release assay (IGRA). C. A chest X-ray. D. A symptom screen. The correct answer is a symptom screen. A healthcare worker with a history of a positive TST should not have another TST, as it will likely be positive again. Instead, the healthcare worker should be screened for tuberculosis with an annual symptom screen. A chest X-ray is only indicated if the healthcare worker has symptoms of tuberculosis. The attributable risk difference of an exposure is calculated as a. Risk in exposed divided by risk in unexposed. B. Risk in exposed minus risk in unexposed. C. Odds in cases divided by odds in controls. D. Incidence multiplied by duration. The correct answer is risk in exposed minus risk in unexposed. Attributable risk difference is the absolute difference in risk between exposed and unexposed groups, estimating the excess risk due to the exposure and the potential benefit of removing it. A healthcare worker develops symptoms of active TB. The most recent TST was negative 12 months ago. How should the occupational health department proceed? A. Repeat the TST to confirm active TB before taking any action. B. Evaluate the HCW clinically, including chest X-ray and sputum AFB smears. Initiate work exclusion and contact investigation if TB is confirmed or strongly suspected. C. Place the HCW on airborne precautions at work while awaiting test results. D. Administer INH prophylaxis immediately. The correct answer is evaluate the HCW clinically, including chest X-ray and sputum AFB smears. Initiate work exclusion and contact investigation if TB is confirmed or strongly suspected. A symptomatic HCW with suspected active TB must be promptly evaluated with clinical assessment, chest X-ray, and sputum AFB smear culture. The HCW should be excluded from work pending evaluation. If active pulmonary TB is confirmed, a contact investigation of exposed patients and coworkers is required. T-Stigra has limited utility for diagnosing active TB. Which regulatory body surveys hospitals for compliance with infection prevention standards as a condition of Medicare/Medicaid participation? A. OSHA. B. The Joint Commission or CMS directly. C. APIC. D. State health departments only. The correct answer is the Joint Commission or CMS directly. CMS oversees the conditions of participation (COPS) for Medicare/Medicaid. Facilities can be surveyed by CMS directly or by an accrediting organization with CMS deeming authority, such as the Joint Commission (TJC). TJC surveys compliance with IC standards including hand hygiene and HAI surveillance. A patient colonized with a multidrug-resistant organism, but without signs of infection should be understood as a. Requiring immediate antibiotic treatment. B. A potential source of transmission who may need contact precautions. C. Not relevant to infection prevention. D. Immune to that organism. The correct answer is a potential source of transmission who may need contact precautions. A colonized patient harbors the organism without clinical infection, but can still serve as a reservoir and transmit it. Such patients often require contact precautions and inform cohorting decisions, even though antibiotic treatment of colonization is generally not indicated. A study reports a relative risk of 2.0 for healthcare-associated infection with a 95 confidence interval of 0.8 to 4.5. What can be concluded? A. The association is statistically significant. B. The result is not statistically significant because the interval includes 1.0. C. The intervention doubles the risk with certainty. D. The sample size was adequate. The correct answer is, the result is not statistically significant because the interval includes 1.0. For a ratio measure such as relative risk, a value of 1.0 indicates no association. Because the 95 confidence interval 0.8-4.5 crosses 1.0, the result is not statistically significant. The true effect could plausibly be protective, null, or harmful. Which describes a confounding variable? A. The main outcome. B. A variable related to both the exposure and outcome that distorts their apparent relationship. C. A random measurement error. D. The intervention itself. The correct answer is a variable related to both the exposure and outcome that distorts their apparent relationship. A confounder is associated with both the exposure and the outcome and is not on the causal pathway, creating a spurious or distorted association. Confounding is controlled by design or statistical adjustment. Which serologic marker indicates immunity to hepatitis B, whether from vaccination or resolved infection? A. HBsAg. B. Anti-HBs hepatitis B surface antibody. C. HBAg. D. HBV DNA. The correct answer is anti-HBs hepatitis B surface antibody. Anti-HBs antibody to hepatitis B surface antigen indicates immunity achieved through vaccination or recovery from infection. HBsAg indicates current infection, and its persistence beyond 6 months indicates chronic infection. Which leadership behavior most effectively promotes a culture of safety? A. Punishing all errors to deter mistakes. B. Encouraging transparent reporting and treating errors as learning opportunities. C. Discouraging staff from raising concerns. D. Hiding data from staff. The correct answer is encouraging transparent reporting and treating errors as learning opportunities. A safety culture is fostered by leadership that encourages open, non-punitive reporting, learns from errors, and engages frontline staff, increasing the detection and correction of system weaknesses. Which of the following best describes transmission-based precautions? A. Precautions that replace standard precautions for infected patients. B. Additional precautions used in conjunction with standard precautions for patients with specific known or suspected pathogens. C. Precautions used only in ICUs for immunocompromised patients. D. Precautions used only after lab confirmation of an infectious diagnosis. The correct answer is additional precautions used in conjunction with standard precautions for patients with specific known or suspected pathogens. Transmission-based precautions contact, droplet, airborne are added to, not substituted for standard precautions. They are based on the route of transmission of the suspected or confirmed pathogen and should be implemented based on clinical presentation, not necessarily awaiting lab confirmation. Which framework helps prioritize quality improvement using rapid, iterative cycles of change? A. ASPAR. B. Plan Do Study Act PDSA. C. SWOT. D. Belmont. The correct answer is Plan Do Study Act PDSA. PDSA cycles enable rapid, iterative testing of changes on a small-scale plan, do, study, act, learning and adjusting before broader implementation, a core method of quality improvement. A hospital is required to report its surgical site infection SSI data to the National Healthcare Safety Network (NHSN). Which of the following is a required data element for SSI reporting? A. The date of the surgical procedure. B. The type of surgical procedure. C. the date of the SSI, D. All of the above. The correct answer is all of the above. When reporting surgical site infection SSI data to the National Healthcare Safety Network (NHSN), all of the above data elements are required: the date of the procedure, the type of procedure, and the date of the SSI. Which of the following viruses is transmitted via the fecal-oral route and is a common cause of healthcare-associated outbreaks in long-term care facilities? A. Influenza A. B. Norovirus. C. Respiratory syncytial virus RSV. D. Cytomegalovirus CMV. The correct answer is norovirus. Norovirus is highly contagious and transmitted via the fecal-oral route, contact with contaminated surfaces, and potentially aerosolized vomitus. It is a leading cause of acute gastroenteritis outbreaks in long-term care facilities, hospitals, and cruise ships. Which of the following is the most important reason for an infection control professional to be a member of the hospital's Pharmacy and Therapeutics PT Committee? A. To provide input on the selection and use of antimicrobial agents. B. To ensure that the hospital is complying with all relevant regulations. C. To represent the infection control department. D. To learn about new drugs that are coming to market. The correct answer is to provide input on the selection and use of antimicrobial agents. The most important reason for an infection control professional to be a member of the PT Committee is to provide input on the selection and use of antimicrobial agents. This is a key component of antibiotic stewardship and is essential for preventing the development of antimicrobial resistance. Which of the following is the best way to prevent the transmission of influenza in a healthcare setting? A. Placing all patients with respiratory symptoms on airborne precautions. B. Requiring all healthcare workers to wear a mask for all patient interactions. C. Promoting annual influenza vaccination for all healthcare workers and patients. D. Restricting visitors during influenza season. The correct answer is promoting annual influenza vaccination for all healthcare workers and patients. The single most effective way to prevent influenza is through annual vaccination. Healthcare facilities should have a comprehensive influenza vaccination program for both healthcare workers and patients. How many did you get right? Let us know in the comments, and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of free practice questions with detailed explanations.